Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I'll give a brief overview of what you need to know about anemia. In particular, I will cover what is anemia, how you treat anemia, and how you can live more successfully or comfortably with anemia. So we start with what is anemia. Anemia is a condition in which you don't have enough healthy red blood cells to carry adequate oxygen to your tissues. If you have anemia, you probably feel tired a lot. There are many forms of anemia, and each with its own cause. Anemia can be temporary or long-term, and it can range from mild to severe. So see your doctor if you suspect you have anemia, because anemia can be a sign of serious illnesses. Treatments for anemia range from taking supplements to undergoing medical procedures. You may be able to prevent some types of anemia by eating a healthy, varied diet. So the symptoms would be fatigue, pale skin, a fast or irregular heartbeat, shortness of breath, chest pain, dizziness, cognitive problems, cold hands and feet, and headache. So initially, anemia can be so mild it goes unnoticed, but signs and symptoms increase as anemia worsens. So causes of common types of anemia. When you're anemic, your body produces too few healthy red blood cells and loses too many of them or destroys them faster than they can be replaced. So common types of anemia and their causes include iron deficiency anemia. So this common form of anemia affects about 1 to 2% of adults. The cause is a shortage of iron in your body. Your bone marrow needs iron to make hemoglobin. Without adequate iron, your body can't produce enough hemoglobin for red blood cells. The result is iron deficiency anemia. And then vitamin deficiency anemias. In addition to iron, your body needs folate and vitamin B12 to produce sufficient numbers of healthy red blood cells. A diet lacking in these and other key nutrients can cause decreased red blood cell production. Additionally, some people are unable to effectively absorb B12 anemia. So, anemia of chronic disease, so aplastic anemia. This very rare, life-threatening anemia is caused by a decrease in the bone marrow's ability to produce all three types of blood cells, so red blood cells, white blood cells, and platelets. And anemia is associated with bone marrow disease. A variety of diseases such as leukemia and myelodysplasia, a pre-leukemic condition, can cause anemia by affecting blood production in your bone marrow. Hemolytic anemias. So this group of anemias develops when red blood cells are destroyed faster than bone marrow can replace them. Certain blood diseases can cause increased red blood cell destruction. So autoimmune disorders can cause your body to produce antibodies to red blood cells, destroying them prematurely. Certain medications, such as some antibiotics used to treat infections, also can break down red blood cells. And sickle cell anemia, so this inherited and sometimes serious anemia, which more commonly affects people of African and Mediterranean descent, is caused by a defective form of hemoglobin that forces red blood cells to assume an abnormal crescent shape or sickle shape. These irregular shaped red blood cells die prematurely, resulting in a chronic shortage of red blood cells. And other anemias. There are several other rarer forms of anemia, such as thalassemia and anemias caused by defective hemoglobin. So next is, how do you treat anemia? So iron deficiency anemia, this form of anemia is treated with iron supplements, which you may need to take for several months or even longer. And vitamin deficiency anemias, so pernicious anemia, is treated with injections, often lifetime injections, of vitamin B12. Folic acid deficiency anemia is treated with folic acid supplements. Anemias of chronic disease. There is no specific treatment for this type of anemia. Doctors focus on treating the underlying disease. Iron supplements and vitamins generally don't help this type of anemia. And aplastic anemia. Treatment for this anemia may include blood transfusions to boost levels of red blood cells. You may need a bone marrow transplant if your bone marrow is diseased and can't make healthy blood cells. Anemia is associated with bone marrow disease. So treatment of these various diseases can range from simple medication to chemotherapy to bone marrow transplantation. And hemolytic anemias. Managing hemolytic anemias includes avoiding suspect medications, treating related infections, and taking drugs that suppress your immune system, which may be attacking your red blood cells. Short courses of treatment with steroids, immune suppressant medications, or gamma globulin can help suppress your immune system's attack on your red blood cells. Certain hemolytic anemias can cause your spleen to become enlarged with damaged red blood cells. Sickle cell anemia. So treatment includes the administration of oxygen, pain-relieving drugs, and oral and intravenous fluids to reduce pain and prevent complications. A bone marrow transplant may be an effective treatment in some circumstances. A cancer drug called Hydrea also is used. And finally, how do you live more comfortably with anemia? So many types of anemia can't be prevented. However, you can help avoid iron deficiency anemia and vitamin deficiency anemias by eating a healthy, varied diet, including iron. So the best sources of iron are beef and other meats. Other foods rich in iron include beans, lentils, iron-fortified cereals, and dark green leafy veg, dried fruit, peanut butter, and nuts. The next is folate. So this nutrient and its synthetic form, folic acid, can be found in citrus fruits and juices, bananas, dark green leafy veg, legumes, and fortified breads, cereals, and pasta. The vitamin B12. So this vitamin is plentiful in meat and dairy products. Vitamin C. Foods containing vitamin C, such as citrus fruits, melons, and berries, help increase iron absorption. Eating plenty of iron-containing foods is particularly important for people who have high iron requirements, such as children. Iron is needed during growth spurts and pregnant and menstruating women. Adequate iron intake is also crucial for infants, strict vegetarians, and long-distance runners. So finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing anemia more effectively on a day-to-day basis. So to start with, we've numerous products to get you started on an exercise program, such as exercise balls and floor mats. So we also have various supplements and products which you can purchase from us without prescription, such as Galfer, Ferrograd, and Active Iron, Spatone, and Cytocon B12. Plus we also stock light boxes to promote relaxation, blood pressure monitors, blood sugar monitors, and body fat monitors to monitor your health. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30-minute clinic with us and we help you increase your understanding and knowledge of your illness. During a telehealth clinic together, we create a cohesive management plan which enables you to take a more active role in managing anemia with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas and Cork or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.